Hi, my name's Helen Thompson. I'm a second year adult nursing student at Liverpool John Moores University. Location was the main thing because I am local. I live in St Helens, but it's had a good reputation. Friends had actually, attended John Moores and done nursing degrees, so I knew it had a good reputation, and other students had enjoyed it, so that was something that I took into account. I'd worked for 8 years in the NHS in the community. I'd got to the top of my band. There didn't seem to be any obvious career progression in the job that I was in as a health trainer. So it was just something sort of natural career progression. Knew I needed to enhance my qualifications, and nursing seemed quite a natural progression for me, which is why I looked into doing an adult nursing degree. Predominantly I'm based at St Helens and Whiston hospitals. At the moment, I'm on a care of the elderly ward at Whiston Hospital, and it's just a fantastic experience. The hospitals are nice and local for me, so I find it quite easy to get to. And just the high turnover of placements that we actually get at John Moores, I think gives you really good patient exposure. It gives you exposure to lots of different disciplines, so I feel that we're really learning at quite a fast pace, but sort of enhancing our skills. I feel quite privileged really to be studying at John Moores. I think you've obviously got the placement experience, so obviously sort of, working closely alongside your mentors and your backup mentors to actually really see what it is like on a ward. I think, already in second year, I've noticed that we've sort of stepped up the game, and so obviously you've got your practical experience doing the placement, but obviously it's backed up with the knowledge. So obviously we have a lot of theory sessions, so you've sort of, the two actually complement each other very well. And I think, although I don't feel ready at the moment, by the time I've finished the course I am confident that I will feel ready to pursue a career in nursing and be a qualified nurse. It's so dynamic. I really enjoy actually coming to lectures, and it probably sounds quite silly, but as an adult learner it's a lot different. So we're kept engaged, the content is interesting and it's relevant as well. I feel like I'm waiting for this bubble to burst, because since I've started the course, life has just been great. I've enjoyed every minute, I've enjoyed every placement. It really, really has been good. But I do feel particularly privileged to be at John Moores. It's when you make the comparison with yourself and other nursing students from other universities that I think that John Moores will actually stand us in good stead when we do become nurses. Yeah, well, I am actually a student mentor myself. I was first introduced to the student mentor scheme when I was in first year and received an email from my student mentor. Actually did meet her for coffee. It was quite nice because there's sometimes questions that you wouldn't want to necessarily ask an academic. So I felt very comfortable speaking to my student mentor. So obviously she introduced me to the scheme, and it was something I thought, yeah, maybe I'd like to give back. So I was actually successful and became a student mentor myself earlier this year. I am confident though that there are jobs out there, particularly in Whiston and St Helens Hospital Trusts. We're always seeing on social media they're having open days, and they actually actively welcome and encourage student nurses, particularly third years, to attend, and with the hope of obviously getting a job. So I'm confident that there will be jobs out there for when I actually qualify.